आपल्याकडे प्रमुख अतिथी म्हणून डॉक्टर मिलिंद कुलकर्णी सर आलेले आहेत. मी सरांना अशी विनंती करते, सरांना आणि सगळ्या मान्यवरांना अशी विनंती करते की त्यांनी या कार्यक्रमाची सुरुवात दीपप्रज्वलनाने करा. छोडिया मॅम प्लीज. सर आज सूर्यदत्ता इन्स्टिट्यूट ऑफ हेल्थ सायन्स, कॉलेज ऑफ फिजिओथेरपी आणि सूर्यदत्ता इन्स्टिट्यूट ऑफ फॅशन टेक्नॉलॉजी यांच्या सहकार्याने वर्ल्ड एड्स डेच्या निमित्ताचे कार्यक्रमाचे आपण 2 सत्रामध्ये विभाजन केले. त्यातल्या प्रथम सत्रामध्ये सूर्यदत्ता इन्स्टिट्यूट ऑफ हेल्थ सायन्स कॉलेजच्या डॉक्टर रुचा वैद्य आणि डॉक्टर स्नेहल ठाकूर यांनी आज सूर्यदत्ता एज्युकेशन फाउंडेशन संस्थेच्या आवारात HIV आणि एड्स याच्यावर माहितीवर समुपदेशन केले. ही आमच्याकडून समाजाप्रती एक छोटं पाऊल म्हणू शकतो किंवा एक छोटासा प्रयत्न आहे. वर्ल्ड एड्स डे 2022 ची थीम किंवा सूत्र आहे इक्वलाइज. इक्वलाइज म्हणजे समानता. समानता ही प्रवाहाबाहेरच्या लोकांना मुख्य प्रवाहात आणण्यासाठी असेल. समानता ही लिंगभेद नाकारून सर्वांना समान अधिकार मिळावे अशी असेल, किंवा समानतेची ओळख ही HIV एड्सच्या बाबतीत असेल. HIV एड्सच्या विषयाला अनुसरून आजही समाजाचा दृष्टिकोन हा इतर रुग्णांसारखा नाही. HIV एड्सचा प्रसार हा फक्त असुरक्षित यौन संबंधांनीच होत नसून तो पसरण्याचे त्यामुळे एड्सचा पेशंट म्हणजे तो चारित्र्यहीन आहे ही समाजाची मानसिकता अतिशय चुकीची आहे आणि ती खोडून काढणे म्हणजे इक्वलाइज. समाजातील सर्व स्तरातील लोक, मग ते उद्योजक असोत, बँकर्स असोत, टीचर्स असोत, डॉक्टर्स असोत, प्रोफेशनल सेक्स वर्कर्स असोत किंवा मिडल क्लास, अप्पर मिडल क्लास, कुठल्याही प्रकारचे लोक असोत, एड्सचा प्रसार हा जाती, लिंग, वर्ण, भेद आणि आर्थिक सुबत्ता याच्यावर अवलंबून नसतो. या रोगांविषयी समान माहिती व उपचार मिळणे म्हणजे इक्वलाइज. याचा आमच्या मेडिसिन मध्ये एक वाक्य आहे, प्रिव्हेन्शन इज बेटर दॅन क्युअर. सो आज आपण HIV एड्स त्याबद्दलची समाजातली भीती, समज, गैरसमज आणि त्या बाबतीतली उपचार पद्धती याची सखोल माहिती आपण जाणून घेणार आहोत. आपल्या कार्यक्रमाला प्रमुख पाहुणे म्हणून डॉक्टर मिलिंद कुलकर्णी आपल्याला आज लाभले आहेत. आपण एप्रिल 2007 रोजी मुंबई विद्यापीठाच्या क्षयरोग आणि छातीरोग निदान या महाविद्यालयातील पदवी अभ्यासक्रम पूर्ण केला आहे. ऑक्टोबर 2008 मध्ये कॉलेज ऑफ फिजिशियन अँड सर्जन पुणे आणि रुबी हॉल क्लिनिक पुणे येथे HIV मेडिसिन मध्ये प्रमाणपत्र पूर्ण केले आहे. सर सह्याद्री स्पेशलिस्ट हॉस्पिटल नगर रोड कोलंबिया एशिया हॉस्पिटल कराड आणि रुबी हॉल क्लिनिक येथे पॅनल कन्सल्टंट सल्लागार म्हणून कार्यरत आहेत. सरांनी नॅशनल एड्स रिसर्च राष्ट्रीय एड्स संशोधन संस्थेमध्ये सुद्धा सिनियर फिजिशियन म्हणून काम केलेलं आहे. यूथ पियर एज्युकेशन प्रोग्रामचे मुख्य सल्लागार म्हणून सरांनी कार्यक्रम केलेले आहेत. सरांचे मार्गदर्शन आपल्या सर्वांसाठी खूप महत्त्वाचं आहे. आजचं सरांच्या नावावर अनेक सन्मानपत्र आहेत. त्याच्यामध्ये CPS TDD कोर्समध्ये 2007 साली सुवर्ण पदक पटकावलेलं आहे आणि महाराष्ट्रात प्रथम आलेले आहेत. सर सप्टेंबर 2010 मध्ये मॉन्टपियर फ्रान्स येथे 8वा प्रगत HIV कोर्स मध्ये भाग घेणारा युरोपियन एड्स क्लिनिकल सोसायटीच्या शिष्यवृत्तीने सरांना सन्मानित केले आहे. सरांनी मलेशिया कोलालंपूर येथे HIV पॅथोजेनेसिस उपचार व प्रतिबंध या विषयावर कार्यशाळेत भाग घेतलेला आहे. वैद्यकीय शिक्षणातील अतिशय नावाजलेल्या अशा जॉन्स हॉपकिन्स युनिव्हर्सिटीमध्ये सुद्धा सरांनी अभ्यासक्रम यशस्वीरित्या पूर्ण केलेला आहे. सरांना इंटरव्हेन्शनल पल्मोनॉलॉजीची विशेष आवड आहे. थोरॅकोसेंटिसिस, इंटरकोस्टल ड्रेनेज, ब्रॉन्कोस्कोपी याच्यामध्ये पण सरांना विशेष इंटरेस्ट आहे. सरांचे पब्लिकेशन किंवा प्रकाशने ही HIV मेडिसिन असोसिएशन ऑफ इंडियाशी कनेक्टेड आहेत. देशविदेशातील HIV एड्स संबंधित अतिशय इम्पॉर्टंट अशा कॉन्फरन्सेस मधला प्रदीर्घ अनुभव सरांकडे आहे. अशा बहुआयामी व्यक्तिमत्वाला आज आम्हाला इथे प्रमुख पाहुणे म्हणून लाभले. त्या मिलिंद कुलकर्णी सरांना मी या विषयावर मार्गदर्शन करण्यासाठी मी इथे आमंत्रित करते. सर प्लीज मंचावर यावे.
First of all, thank you everyone and for inviting me for this lecture today. Unfortunately, there is some technical issue as far as the PowerPoint presentation is concerned. I tried my level best to get all the pictures from for the HIV per se, but म्हणजे तुम्हाला पिक्टोरियल प्रेझेंटेशन देण्याकरता सोपं जाईल मी या उद्देशाने केलं, but I think that is creating a new problem here. So anyway, आपण जे आहे त्याच्यात आपण जायचा प्रयत्न करूया पुढे. आय थिंक आज सकाळी तुम्हाला जे लेक्चर घेतलंय मॅडमनी इथल्या फिजिओथेरपीच्या, तर त्याच्यात तुम्हाला सांगितलंय व्हॉट इज मीन बाय HIV. HIV इज नथिंग बट अ व्हायरस ओनली, ह्युमन इम्युनोडेफिशियन्सी व्हायरस. ओके, त्याचं इन्फेक्शन झालं म्हणजे पेशंटला एड्स झाला का? तर नाही, इट जस्ट इन्फेक्शन. तो विषाणू त्या पेशंटच्या किंवा त्या रुग्णाच्या शरीरात असतो, फाईन. पण जेव्हा त्या पेशंटला किंवा त्या रुग्णाला ट्रीटमेंट मिळत नाही HIVच्या विरोधात किंवा HIVच्या अगेन्स्ट, then over the period of time, say for example 3 years, 5 years, 8 years down the line, or maybe up to 10 years as well, then patient starts presenting some sort of a symptoms. So symptoms काय असू शकतात? TB होणे, कावीळ होणे, अतिसार म्हणजे ज्याला आपण लूज मोशन्स होणे, किंवा आपण हर्पीस जोस्ट ज्याला नागिन म्हणतो तशा टाईपचे आजार होणे, पेशंटचं वजन घटणे, थंडी वाजून ताप येणे, तब्येत क्रश होत जाणे. म्हणजे फॉर एक्झाम्पल एखादा 60 किलो वजनाचा व्यक्ती असतो, पण ओव्हर अ पिरियड ऑफ से फॉर एक्झाम्पल 3 to 4 months or maybe 6 months ही डिक्रीजेस हिज वेट बाय मोर दॅन 10%. म्हणजे 60 किलोच्या वजनाच्या पेशंटचं वजन 6 किलोच्या खाली जातं, म्हणजे साधारणतः 54-55 वर येतो. सो दीज आर द सिम्पटम्स with which, or if the patient goes with these symptoms to the doctor, then doctor is supposed to check that patient or subject that patient for the HIV testing basically. Fine. So as I said, AIDS, HIV is just an infection and AIDS is the last stage of HIV infection. Last stage म्हणजे काय? When the patient becomes symptomatic with different kind of म्हणजे 2 ते 3 आजार एकत्र त्याला व्हायला लागतात किंवा रोगाची लक्षणं दिसायला लागतात. म्हणजे वजन घटणे, TB असू शकतो, लूज मोशन्स, त्याला अन्ननलिकेतला काही इन्फेक्शन झालेलं असू शकतं, तोंडामध्ये पांढरे चट्टे येणे म्हणजे कॅन्डिडा म्हणजे फंगल इन्फेक्शन झालं असू. असे 3 ते 4 लक्षणं जर एकत्र दिसायला लागली तर त्या स्थितीला आपण एड्स म्हणतो, म्हणजे ॲक्वायर्ड इम्युनो डेफिशियन्सी सिंड्रोम. म्हणजे ज्या HIV मुळे प्रतिकारशक्ती घटल्यामुळं वेगवेगळे आजार त्या रुग्णाला पकडू लागतात किंवा तुम्ही म्हणू शकता त्याच्या शरीरात वास्तव्याला येतात. ह्या 3-4 आजारांचा एकत्र समूह म्हणजे एड्स, ॲक्वायर्ड इम्युनो डेफिशियन्सी सिंड्रोम. फाईन. So HIV is a virus that spreads through the body and attacks the immune system, weakening it to a point that it cannot fight against the infection and disease. That's what. Like immunity, HIV is a virus that is going to attack on the CD4 cells, which are the scavengers, or you can say आपली प्रतिकार शक्ती ज्या माध्यमातनं दिसते किंवा HIV ला रोखण्याकरता जी प्रतिकार शक्ती आपली कार्यरत असते ती CD4 च्या माध्यमातनं काम करत असते. तर हा जो व्हायरस आहे हा CD4 वरच हल्ला करतो. CD4 चा हल्ला केल्यानंतर CD4 ची संख्या हळूहळू कमी व्हायला लागते. त्यामुळे कुठलाही साधा आजार सुद्धा रौद्र आजार मध्ये कन्वर्ट होऊ शकतो. दॅट इज व्हॉट इट इज वीकनिंग that immune system to such a level that the patient cannot fight against the infection or disease. And if still the patient or his condition is untreated, then it can lead to AIDS, which is fatal. Patient may or the रुग्ण त्या आजारामध्ये दगावू सुद्धा शकतो. So there are main 3 steps of the HIV. म्हणजे HIV च्या लाईफ सायकल मध्ये if untreated HIV progresses in 3 stages. That is, first is acute infection. Acute infection म्हणजे काय? समजा फॉर एक्झाम्पल XYZ म्हणजे 1 जानेवारीला एखाद्याला आजाराची लागण झाली, पण ती पेशंटला लक्षात येत नाही. मे बी पहिल्या महिनाभरात किंवा 15-20 दिवसात त्याला साधा सर्दी ताप खोकला, जो की सध्याच्या वातावरणात सगळ्यांना माहिती आहे की कोविडमुळं, डेंग्यूमुळं, H1N1 मुळे किंवा साधं सध्या पण काही लोक खोकतात, म्हणजे दे माइट बी सफरिंग विथ अ कॉमन कोल्ड. दिस काइंड ऑफ नॉर्मल काइंड ऑफ अशा पद्धतीचे लक्षणं त्याला स्टार्टिंगला पहिल्या महिन्यात दिसू शकतात. पण जर त्याची रिस्क बिहेवियर जर आपण तपासलं त्या डॉक्टरनी, डॉक्टर कॅन आस्क देम टू दॅट पर्सन टू गो फॉर अ HIV टेस्ट. इन दॅट केस यू कॅन कॅच द इन्फेक्शन इन अक्यूट स्टेज. लाईक 1 जानेवारीला झालं आणि तुम्ही ते मार्च एंड पर्यंत डिटेक्ट केलं, दॅट इज कॉल्ड अक्यूट इन्फेक्शन. देन क्लिनिकल लेटेस्ट. नाव आता काय होतं, जर ते लक्षात नाही आलं आपल्याला, त्या पिरियड मध्ये जर आपल्याला लक्षात नाही आलं की हा HIV आजार झालाय, पण आपण तो निदान करू शकलो नाही, then HIV is a very smart and loyal virus. What we call in our clinical practice is a smart and loyal. एकदा शरीरात गेला शेवटपर्यंत निघणार नाही. स्मार्ट, स्वतःमध्ये सारखे बदल घडून आणतो. त्याच माध्यमातून हा आजार, हा HIV चा आजार सुप्तावस्थेत जातो. The HIV virus per se goes in a dormant stage, but simultaneously it continues attacking immune system of that particular person. So simultaneously CD4 is going to come down slowly over a period of time. So this is called as a clinical latency. म्हणजे त्या पिरियड मध्ये पेशंट एकदम धष्टपुष्ट असतो, त्याला काही सिम्पटम नसतात, त्याचं रुटीन चालू असतं, ही डझंट हॅव एनी काइंड ऑफ अ सिम्पटोमॅटॉलॉजी और काहीही लक्षण दिसून येत नाही. त्याला म्हणतो आपण क्लिनिकल लॅटन्सी किंवा असिम्पटोमॅटिक फेज ऑफ HIV. But the patient's body is harboring that HIV infection and he is likely candidate to transmit that infection to others as well, especially his sexual partner. Then comes last stage comes is a AIDS, acquired immunodeficiency syndrome, which might be from acute infection to AIDS. It may take more than 3 years or maybe 5 years or up to 8 years as well to show the symptomatology. Fine. So now महत्वाचा प्रश्न, who is at risk? Fine. So we being a medicos or we in the medical fraternity are at high risk, you can say, like especially if you are doing bare-handed some sort of a procedures, or maybe you are handling the patients without following the universal precaution as far as our medical fraternity is concerned. Fine. But mainly HIV can be contracted by anyone irrespective of age, caste, demographic and socio-economic strata. However, certain groups who are increased risk, like people who inject drugs, like Manipur, Nagaland, Sikkim, आपल्या त्या एरियामध्ये IV ड्रग अब्युजर जास्त असतात. मादक द्रव्य आपण जे आपण पुण्यामध्ये ऐकतो की रेव पार्टी वगैरे झाली. So in that case, one single needle will be used by 10 people for going for a नशा का काय म्हणतो आपण त्याला, मादक द्रव्य, LSD. आजकाल आपण बऱ्याचशा गोष्टी ऐकतो टीव्ही मध्ये, पेपर मध्ये बघतो. Then people who have a multiple sex partners. Then babies born to mothers who is having HIV. So ह्यामध्ये इथं कसं जाणार आहे, babies from a positive mother. HIV will transfer from mother to fetus or baby at the time of delivery or maybe later on after during the breastfeeding. So this is more important. And nowadays, if you go, like government is coming up with in a big way, they are making awareness of everything. Like if you go see that picture, Urta Punjab, you must be aware of that, Urta Punjab. So in that also, what is the purpose of these kind of movies? They want to bring the awareness, just say no to drugs. So if when someone goes for the drugs, what they are doing, they also don't know. Fine. So that is the main important as far as your young population is concerned. Then people having multiple sex partners. So पूर्वीच्या काळात एक ऍडव्हर्टाइज यायची बघा दूरदर्शनवर, जवान हूं बट नादान नहीं. You must be aware of that. I don't know. It comes in Doordarshan. So that everyone has to. You can be a friend. You can be intimate with each other, but to a certain extent only. And if at all you want to be intimate, going ahead, then you have to use protection. That is the basic crux of the relationship or your friendship as well. And then babies, as I already discussed. And now it is important to know how that HIV doesn't get transmitted. So I am just showing the pictorial presentation that semen and vaginal fluids are the route of transmission, sharing injectable devices or syringes, needle stick injury. I was just discussing with your madam that today only I got one lady in my clinic. She had a prick 5 years back. But she had a phobia of that HIV still. After 5 years old, she is not able to overcome that phobia. So she is getting repeated tested, but still she is not getting satisfied. So now this kind of patient need a lot of, more settings of, you can say, counseling. Fine. You have to give some sort of examples, maybe some sort of real-time examples as well. Then and then they can believe on that and they can go ahead. Then again it can be transmitted via infected blood. Nowadays injectable needle stick injury and infected blood, or maybe you can say sharing injectable devices, is almost negligible, because our Indian government has made some sort of a stringent rules. Like blood bank too has to follow some stringent rule that even if you donate your blood, they will test your blood with 4 or 5 different kind of a testings, and if something comes positive, they will discard that blood. And if HIV comes positive, they will inform to that particular person and they will refer to that patient to the particular higher center or maybe government center for confirmation purpose and further treatment and management. So then during pregnancy, as I said, during pregnancy or birth or at the time of breastfeeding. So now more important, how HIV is transmitted, but HIV is not transmitted by air or water, then saliva, sweat, tears or closed mouth kissing as well. I do get so many patients, they say that I was intimate with someone, I had some close kissing as well, whether I will be infected or not. So the answer is going to be no. But however, with that as well, you have to emphasize on the protected kind of a sexual relation. Again, insects and pets, or maybe बरेच जण म्हणतात आम्ही एकत्र नवरा पॉझिटिव्ह असतो, बायको निगेटिव्ह असते, घरातले लोक पॉझिटिव्ह असतात, निगेटिव्ह असतात, पण त्यांचा प्रश्न हा असतो की त्यांचा डास मला चावला, त्यांचा ढेकुण मला चावला, तर whether I will be infected. So no, it's a नावातच HIV, human immunodeficiency virus. So that virus doesn't get replicated in other species, or mosquitoes, they don't have a habit of biting one with someone and they will immediately go and bite to other. No. Fine. And that HIV doesn't get transmitted, and HIV doesn't get multiplication as well in their body. Again, sharing toilets or food or drinks doesn't transmit HIV. So now main important thing that how to test this HIV. So what are the tests to be done? Enzyme linked immunosorbent assay, which is called as ELISA. Then Western blot, both are antibody tests. Polymerase chain reaction, it is just a nucleic acid amplification test, which has to be done especially in babies who are born with the positive mother. And because kids or maybe babies, they give false positive antibody testing result till age of 2 years, or you can say 18 months to 2 years. So DNA PCR or you can say RNA PCR is mandatory, or you can say prudent to go for the testing in this kind of kids. Even those who have exposed recently, maybe after 1 month, they want to bring down the window period. So what is meant by window period? Window period is nothing but a contracting HIV on a particular day and reflecting that HIV in your blood. So the time taken for this is called as a window period. So during this period of time, you may get a false positive or false negative results as well. Fine. So once you are positive, maybe this takes almost more than 6 weeks to 3 months, or maybe up to 6 months as well. 6 weeks to 6 means how much? Almost 24 weeks. You have to wait till 24 weeks. So that is called as a window period, WP. So this is everyone read on the internet and they come and ask, oh, sir, what is meant by window period? So we should be in a position to explain them. Again, immunofluorescence test is also antibody test. Antibody means HIV virus goes inside the host body, then whatever the immune response developed by that person against that particular virus is called as a antibody. ठीक आहे, त्याला आपण मराठीमध्ये प्रतिपिंड म्हणतो. So where you can do this testing? You can do this testing in the specialty or maybe HIV specialist, sexual clinics, or maybe skin specialist, in a voluntary counseling testing centers like in government center. Then there are certain NGOs which carries, which has a long, so much amount of data. Those who are having a promiscuous behavior or having a relationship with the LGBT community, you must be aware of that. So those NGOs are working from them. They can directly ask them to go to the particular center and get themselves tested. And community test centers are there, health clinics are there, and family planning, especially. Similarly, whatever we are doing for like diabetic patients, we are checking them for the hypertension or maybe cardiac condition. Similarly, a patient with a TB or a patient or person who is or the lady who is pregnant, in those kind of people also you have to go ahead upfront for the HIV test. So this is complementary to each other. Even if a skin specialist dealing with a STD, sexually transmitted diseases, he has to ask for a different array of testing like HIV, hepatitis B, HCV, then chlamydia, gonorrhea, syphilis, maybe you can say HSV like herpes simplex virus as well. So there is an array of testing. So in that HIV also is important test. Fine. And many of the patients, those who are coming to STD clinics, they found to be HIV because HIV, STD, HIV, TB, HIV pregnancy are complementary to each other because this is called as a surveillance. Our Indian government has started surveillance in 1985 almost, and it has been enhanced in 1992 and 1995. So later on it has been called as a sentinel surveillance. Sentinel surveillance म्हणजे काय? ज्या ठिकाणी तुम्हाला जास्तीत जास्त पेशंट्स मिळू शकतात किंवा जिथे रिस्की बिहेवियर आहे, तो रिस्की बिहेवियर कुठे असणार आहे? सेक्शुअली ट्रान्समिटेड डिसीजेसच्या क्लिनिक्स मध्ये किंवा स्किन स्पेशलिस्ट कडे, गायनेकोलॉजिस्ट कडे. दोज हु आर प्रेग्नंट, दे आर कमिंग, यू हैव टू गो अपफ्रंट फॉर द HIV टेस्टिंग. द वन हु इज हॅव्हिंग अ ट्युबरक्युलोसिस, बिकॉज TB इज अ कॉमनेस्ट ऑपॉर्च्युनिस्टिक इन्फेक्शन. म्हणजे TB हा एक संधी साधू आजार आहे. तो कोणामध्ये दिसतो? HIV पॉझिटिव्ह इंडिव्हिज्युअल्स मध्ये कॉमनली दिसतो. Fine, not necessarily sputum positive TB, but generally you get a patient with a lymph node tuberculosis or extra pulmonary tuberculosis. म्हणजे फुफ्फुसांच्या व्यतिरिक्त दुसऱ्या ठिकाणी झालेला TB. So you have to take advantage of these kind of diseases and you have to ask the person to go for a HIV testing upfront. So this is called as a sentinel surveillance. Again, so now your next question will be whether there is a cure for HIV. So no. So there is no cure for HIV as of now. There is no vaccine for HIV as of now. However, we have a lot of research going on, and with the problem of this COVID, we are able to. We have to appreciate those scientists. They have done a great job finding out the COVID vaccination like Covishield, Covaxin, and rest of the Sputnik and rest of the other different kind of vaccination. But there is no vaccine as of now in HIV. However, we can manage and control the viral infection through the regular use of antiretroviral therapy that slows the progression of virus in your body and helps prevent transmission. Fine. So antiretroviral therapy, it's a combination of 2 to 3 drugs which will prevent the multiplication of that virus or which will inhibit the multiplication of that virus. That doesn't mean that patient becomes negative after being positive. No, not at all. It just controls the replication of that virus. But it is not the drug has to be taken जब मन में आया लिया बाद में बंद कर दिया. No, not at all. It has to be continued lifelong. Once you start it, you have to continue lifelong. This therapy must not be broken. As I said, like it must not be broken because it can help to keep the immune system stronger, making us better able to fight other infections. Again, how you have to monitor these kind of patients? After starting them on the antiretroviral therapy, you have to go for a CD4 testing. As I said, प्रतिकार शक्ती ज्याचं मोजमाप करतो त्याला आपण त्या युनिटला आपण CD4 cells म्हणतो. So you have to go for a CD4 testing. Now we have a viral load, which is a RNA PCR, nucleic acid amplification test, for monitoring purpose of these kind of HIV positive individuals. Whether that treatment is working on them or not. Say for example, if a person who is positive for the first time, not started on antiretroviral therapy, his CD4 might be 200 and his viral load might be somewhere around 1 lakh copies per ml. Now once you start him on the patient on the treatment, maybe after 6 months, you have to go for a repeat testing of CD4 and viral load. CD4 might be 300 later on and viral load might be undetectable. So you have to, once you are undetectable viral load, you have to sustain with that, and that point in time U is equal to U. Undetectable viral load is equal to untransmissible. The person is not able to transmit his or her virus to others. Fine. However, it is also even if this is achieved, still you have to advise them for a safer sex practices. Fine. So, as I said, CD4 count and viral load test are in addition for the general health test and can help for monitoring the infection. So, this is just how to stop going in the condition of AIDS. So, here you can see like the patient has a sexual intercourse, how the HIV transmits via sexual intercourse, maybe sharing injectable devices, blood transfusion, mother to child, then patient gets contracted with HIV, then patient has a viral syndrome, as we have discussed. He might be having some xanthem of fever, chills, rigors, or maybe some sort of a illness for a initial phase of time. Then later on, once the patient gets detected with HIV, the patient will be sent to AIDS center. Then patient will be clinically examined for his opportunistic infections, and then ultimately patient starts with antiviral drug. Then you have to go with the, you have to counsel that patient for the safer sex practices, and with this whole cascade, or you can say route, you can stop going into the stage of HIV. So now you will ask, if the person is on HIV treatment or anti-HIV treatment, how many days he can live, or how much his life is going to be. So we are not God. We are not able to predict anyone's life. However, if the patient or that person, तो जो रुग्ण व्यवस्थित न चुकता जर गोळ्या औषध घेत असेल कोणत्या एचआयव्हीच्या, प्लस निरोगी जीवनशैली, ताणतणावमुक्त आयुष्य, पोषक आहार, जे काही त्याला व्यसन आहे त्याच्यापासून दूर राहणे, ह्या गोष्टी जर तो पाळत असेल, ही कॅन हॅव अ नॉर्मल रुटीन लाईफ. तो त्याचं आयुष्य अगदी नॉर्मल जगू शकतो. याचा अर्थ काय? HIV was called as a death sentence previously in 2004, maybe you can say up to 2010 as well. But with the advent of different kind of a research, म्हणजे भरपूर जे काही संशोधन झालंय, जेवढं HIV मध्ये संशोधन झालंय मागच्या 25-30 वर्षात, तेवढं मला खचितच वाटते की कुठल्या बाकीच्या सब्जेक्ट मध्ये झाला असेल. ऑफकोर्स झालेला आहे, but HIV might be a driven force for them as well. Fine. So patient can have a normal routine daily life without any hassle. They can have their whatever kind of a responsibility they are going to be able to fulfill that responsibility. So here in pre-heart era, heart म्हणजे highly active antiretroviral therapy. So pre-heart era म्हणजे pre-heart जेव्हा antiretroviral therapy आपल्याकडे अवेलेबल नव्हती, पहिली antiretroviral ड्रग आपल्याकडे 1998 मध्ये आला. Then government has taken an initiative, then they have started antiretroviral therapy center like ART centers since 2004 onwards. Till that time, or maybe up to 2006-8 as well, the average age of that particular positive person is 80. Fine. Then subsequently, slowly it went to 36, then 41, 55. Now with the advent of highly active antiretroviral therapy, which is called as a potent antiretroviral therapy, you can have people living with HIV more than 60%. तो मी माझ्या पेशंटला सांगतो की साधारणतः समजा एक 30 वर्षाचा मुलगा आला, तो म्हणतो माझं लग्न झालेलं असेल, मला होता मी किती दिवस जगणार. मी त्याला क्लिअर कट सांगतो की तुम्ही 70 वर्षापर्यंत आरामात जगू शकतात, कारण भारतातल्या प्रत्येक सरासरी आयुष्यमान किती आपल्या भारतातल्या लोकांचं 65 ते 70. इफ यू आर अचिव्हिंग दॅट अँड इफ यू आर गोइंग बियॉन्ड दॅट, इट इज गोइंग टू बी अ बोनस फॉर यू. And till the age of 70, you can fulfill all your responsibilities, even for your children's health. Fine. So this is the beauty or that advantage of that particular antiretroviral therapy. For that, you have to be very much regular as far as treatment part is concerned. So the statistics is a little different because my presentation is not there. Now India has today also India is the third largest HIV epidemic country in the world, which has a 2.1 million. साधारणतः 21 लाख आजच्या डेट मध्ये नवीन स्टॅटिस्टिक्स प्रमाणे 24 लाख HIV पॉझिटिव्ह लोक आपल्या भारतात आहेत. When I joined this field in 2006-7, that time the number was 36 lakhs. Fine. The most important thing is for us to do is to break the taboo or around this disease and have open and informed conversation about getting tested and treated. As in the initially one of your teachers told that samanata, equalize is the theme. घोषवाक्य काय WHO the World Health Organization samanata. Everyone has to be on the same platform. You can discuss each and every damn thing with them. Don't feel them that they are segregated, they are isolated. त्यांना हिणतेची वाळीत टाकल्याची वागणूक देणं योग्य नाही. You must be aware that you guys are I think तुम्हाला सगळ्यांना आता कोविडचा अनुभव आहे. कोविडच्या स्टार्टिंगला पण कशा पद्धतीने लोकांनी ट्रीट केलं एकमेकांना, which is some sort of a hatred or disparity or disregard to them or towards the society, as if they are not going to get the COVID. Or say for example, if they are not following the dictum of having a safer sex practices and injectable drug abuse, or maybe some sort of route of transmission, they are also going to be affected naturally. No one will be like escape from that particular. HIV can happen to anyone, like right from kid to the age of 80 or maybe plus more than that as well. No one may be spared if they are behaving in a risky way. So India is working with the international organization, local authorities to end AIDS by 2030. So in this point in time, UNAIDS has decided a target like 90-99. 90% of the people should be tested for HIV. Once you are diagnosed with that particular HIV, 90% of them should be put on antiretroviral therapy, and they should be virally suppressed. Out of that, 90% should be suppressed. Like त्यांनी HIV च्या गोळ्या खाल्ल्यानंतर त्यांचा व्हायरस सप्रेस होतो का नाही ते पण 90%. So 90, 90, 90. Now the same bar has been increased up to 95, 95, 95. So for India, it is far long to go to achieve this target as of now. So we must not subject individual with HIV to any kind of judgment or discrimination, but encourage them to get treated and prevent further transmission. So this is nothing but a equalization. Or this is nothing but a samanata. Asamanata ji hai. If you go with the inequalities, that will hamper the progress of HIV or hamper the progress in HIV field. So what you have to do? You have to bring up the bar and make it at a same level. Don't consider them as a segregated person. So can we end AIDS epidemic? So measures, if used judiciously, can reduce with more than 80% decline in estimated new infection from peak epidemic in 1995. Estimated AIDS-related death declined by 71%, and since its peak in 2005. So annual decrease. Sorry, annual म्हणल्यापेक्षा decade 95 to 2005. It's a one decade. So during that period in time, with the awareness and continuous work in with the all NGOs, new infections every yearly has been reduced more than 80% in 2005. Nowadays, the same number is somewhere around almost 76% in 2021 to 2011 to 21. And the AIDS related death, which is called as ARD, which is 71% in that period of time, now it's almost more than 46, or you can say achieved 50% decline in the AIDS related deaths. So these includes what are the measures to be taken? ART for everyone irrespective of CD4 count, the use of HIV treatment as a prevention, the rolling out of male circumcision programs, use of triple drug HIV therapy as we have discussed, and mind well, this antiretroviral therapy is safe in pregnancy as well now, because there were some drugs which are teratogenic for the fetus or maybe baby that has been taken away, or you can say research has proven it is later on to be safe. Pre-exposure prophylaxis is a new terminology. Means if you are anticipating a sexual encounter, you can start treatment 7 days before only, just to get the level of the antiretroviral therapy in your blood, therapeutic level of the antiretroviral therapy in your blood. Then you can have intimacy, or maybe you can anticipate and go for a sexual relationship. However, PrEP is not a replacement for sex practices. No, not at all. Person has to go with the protected sex only. And again, as I said, TB is the most commonest opportunistic infection. So intensified case finding for TB patients with HIV and HIV in patients with TB. Like both. If a person with TB comes, screen the patient for HIV. If a HIV patient comes, screen the patient for the tuberculosis. First start with the TB. If found to be positive for the TB, you have to go with the TB treatment and then subsequently HIV treatment. So this is a path to a longer, healthier life with HIV. So here, the person is been just diagnosed here with HIV, and he is going to visit the healthcare provider regularly, then start treatment as soon as possible, take HIV medicines every day. Then, what does that HIV antiretroviral therapy does? Less HIV in the body, stronger immune system, less risk of HIV related infections, and less risk of HIV transmission as well. Now I do get many of the recently married couple. Out of that, one is positive, one is negative. What is called as a serodiscordant couple. विसंगत जोडतो. एक जण पॉझिटिव्ह आहे, एक जण निगेटिव्ह. 8 महिने, 10 महिने किंवा 1 वर्ष, 2 वर्ष झाले असतात. They want to go for a baby. How? It's a big question. So where comes PrEP, pre-exposure prophylaxis. Say for example, husband is positive. He will be started on the antiretroviral therapy. Then his viral load will be brought down to the undetectable level. What I said, U is equal to U. Undetectable means untransmissible. However, now at this point in time, we don't want to take any kind of prophylaxis. Still, that point in time, the negative part will be given a PrEP, which is comprises of 2 drug therapy. Combination of 2 drug. The other partner will be given PrEP. And that point in time, they have to go for a natural sexual relationship so that she gets conceived. And once she gets conceived, the treatment will be stopped for her, and the relationship will be stopped for her, say for example, till the baby delivers. Okay. However, if this opposite things happen, like female is positive, husband is negative. Husband is likely to go for likely candidate to go for a PrEP, pre-exposure prophylaxis. And the positive female will be on the treatment. Her viral load will be brought down at the U level, like undetectable level. U means untransmissible. That U undetectable will not be transmitting her HIV to fetus or that baby. However, that baby has to be delivered by cesarean section, because a lot of chances of there going to be if you go for a normal delivery with the vaginal delivery. So you have to bypass the route. You have to bring out the baby via cesarean section. And later on, as the baby came from the womb of that particular lady who is positive, baby has to go for a PEP, which is called as a post-exposure prophylaxis for 6 weeks, which is one drug which is called as a nevirapine or maybe zidovudine, or maybe we can go for a lopinavir, ritonavir as well. And then later on, just to confirm, make it confirm that whether that bachu is positive or not, you have to go for a DNA PCR test that we have discussed, that nucleic acid amplification test. First at 6 weeks of his age, and then after at around 6 months. 2 tests, DNA PCR negative, bachu is negative. And maybe later on after 2 years, you can confirm by the antibody. And that bachu can have a normal life without any hazard. So this is PrEP. So So this is a long, old, presentation that has been here. So in 4 वर्षापूर्वी, the equalize was the theme. Now that time it was know your status. So that time the theme was know your status. If you are sexually active with multiple partners, or you have been exposed to any potential risk, know your HIV status through testing. Speak to your doctors about HIV prevention, treatment and care services. Current options for initial therapy are highly effective, durable, convenient and well tolerated and show less evidence of long-term toxicity. आता तुम्हाला गोळ्या रोज रोज घ्यायच्या म्हणल्यानंतर पेशंट काय म्हणणार, मला त्रास होणार, मला त्याचे साइड इफेक्ट होणार का? These are the common questions. Now just I will highlight about the PEP. दूसरे एक presentation. There is one small about PEP, post-exposure prophylaxis. So as far as physiotherapy part is concerned, you guys are going to be later on future physiotherapists. So as today you are in a first year, so it's my duty to tell you about the post-exposure prophylaxis. By any means, if you are handling a person who is positive, please go with the gloves in your hand. You have to follow universal precaution. Everywhere, universal precaution, you know, wash your hands 2 to 3 times. You must be aware in the COVID era as well. Fine. Later on, if you are handling that patient, don't touch barehandedly to his or her bleeding wounds. Or if you have a scratches or something, wound on your hand, just avoid touching to those kind of patients. By accidentally, if you found to be having a prick of that needle, who is HIV positive patient, who you are giving some injection, or maybe his blood might have been, you are exchanging the blood, if you are taking the blood patient for the patient's blood for the testing or something, and same needle got pricked to you, you have to go for a PEP. But PEP is only for a emergency situation. It is for only possible exposure, just to prevent the transmission of HIV, possible transmission of HIV. But the treatment has to be started within first 72 hours. दिलेल्या वेळेपासून तुम्हाला 72 तास कॅल्क्युलेट करायचे आहे. Even if this can be taken in scenario like in a rape condition, the one who got raped, that has to be the lady has to be given for a PEP. Even those who are operating on HIV positive individuals, if they get a prick or they get a scalp or some splash of the blood in the eyes or on your body, then you can go for a PEP, but has to be taken within first 72 hours. So PrEP is different, PEP is different. PEP is only for the accidental, or you can say emergency situation only. PrEP is anticipated. You are anticipating a kind of a sexual exposure, maybe by weekend, then you should start the treatment from day 1. Fine. And I think, okay, great. So as I said, PEP stands for the post-exposure prophylaxis, and it means taking antiretroviral medication after being potentially exposed to HIV to prevent becoming infected. And it has to go for a start within first 72 hours, and it has to be continued till 28 days. Anyway, so sorry for the technical errors. Actually, I was about to show you every pictorial presentation. Unfortunately, that system is not supporting. I hope this is good enough. तुम्हाला काही क्वेश्चन असतील तर विचारू शकता फ्रंट. I think I have given one मराठीतलं मी एक क्वेश्चन आन्सर 2 पेपर्स आणलेले आहेत. I have given to someone. शेअर करून तुम्ही देऊ शकता सगळ्यांना later on, and it has a question answer kind of a discussion, so that just to clarify your doubts. Still, if you have any questions, you can ask me Oh, I'm happy to answer.
The PrEP or PEP will help us to fight HIV, prevent HIV. But what will be the toll taken on the body by that medicine? As a normal person, will my immune system be affected or my body be weakened by those medications?
It is not going to affect your body because it has to be for a short period of time. So as I said, PEP has to be taken only for 28 days. Likewise, PrEP, pre-exposure prophylaxis has to be started 7 days before the anticipated exposure and has to be continued on daily basis, maximum up to 3 months. Then you have to stop it. You have to check for your blood investigations. However, in PrEP as well, there is a one technology. However, we don't recommend to go for that. We don't encourage. It's an on-demand PrEP. So if you found to be having a anticipated sex maybe tomorrow, you take tablet today, 2 tablets today, 1 tablet before the intimacy, then for total 4 days. It's called as an on-demand or event PrEP. But ideally it should be discouraged. Ideally everyone has to be, as far as PrEP is concerned, you have to be on a daily treatment so that the therapeutic level of the drug should be maximum in your blood. Also, these are very potent antiretroviral therapy with zero side effects. Almost you can say zero side effects. So your immune system is not going to be weakened. Your body will not going to be react for that. You are not going to have a rashes or maybe some sort of a vomiting, diarrhea, minute kind of a side effect or maybe problem might be there. But generally, patient do tolerate very well. I have an experience. No one has that alarming kind of a side effects. Previously it was with zolpidem kind of a treatment which was having a severe gastritis, even anemia, your blood is going to be decreased in your body, or you can say hemoglobin got dropped, anemia, and most of the times a patient do have a continuous nausea and vomiting, gastritis kind of a situation. Even previously we used to give PEP, which is lopinavir ritonavir as well. So it has 2 tablets in the morning, 2 tablets at the night, bigger one, 2 tablets in morning, night, and it has a intractable diarrhea is the side effect. So patient बोलतो की बाबा नको, भूक नको, पण सॉरी काय म्हणतात त्याला, मला ती ट्रीटमेंट नको, काहीच नको. I will be happy without taking any kind of a treatment. So now with the advent of these continuous innovations and research, we are treating HIV positive with STI, single treatment tablet regimen. So 3 different medicines combined together, it is called as a fixed dose combination. Nowadays, what the medicines which we were using before 2015, now today I am not using. Patient used to have carry drugs in ice box as well. Initially, atazanavir, ritonavir was the tablet, has to be kept in the freeze. Nowadays, you can keep all drugs in a room temperature, on a room temperature, and a small bottle, small like button is the button एवढी तुमच्या त्या गोळीची size, not a bigger tablet. So now we are going towards the nanotechnology as well. Now maybe by December 2023, we may get a injectable antiretroviral therapy, which is cabotegravir and rilpivirine. So there is a lot of research going on in HIV field. Even we have also presented so many data from India, abroad as well. We have also come up with a different kind of ideas as far as neurocognitive impairment in HIV positive individuals is concerned. I have a personal interest in cognition treatment, like neuroaids, how HIV and AIDS affects on your brain. So we have a paper presentation and it has been accepted worldwide. So there are some certain drugs which bring down your virus in blood, but that doesn't bring down your virus in the brain. The patient do present with some sort of a neurological symptom, and if you switch that patient on a CNS penetrating drug, dramatically patient improves. But however, the number of chunk of the patients are very less. But still, you have to have a high suspicion of index. Likewise, PrEP, PEP, upfront, I do get almost every day 1 or 2 patients for PEP, or maybe nowadays with this Article 377, like LGBT community. So those guys are coming upfront for the PrEP, pre-exposure prophylaxis. So it doesn't have any kind of a side effects. So that's what I said, like ART is a convenient, durable and potent to achieve the viral load at an undetectable level. And once you are achieved that, you are not able to transmit the virus to others.
So like for AKT, anti-COX treatment, as a health professional, we need to make sure that the patient is taking our medications. So like we usually ask them what is the color of the urine, so you know they're taking the rifampicin. So here in case of ART, is there some way to make sure that the patient is following our medications religiously?
If you go to the government center, as Dr. Simmi was going to Sasun hospital, so we used to calculate the adherence of that particular patient. So every monthly that patient will be given 30 tablets. That bottle contains 30 tablets. So once he is going to have a follow-up visit, that time we are going to check his tablets. If he completes 28 days medicines and he is remaining with the 2 days, perfect, he is following, his adherence is 100%. If he is missing out some medicines, or he has lost some kind, taken excess amount of medication, then his adherence is going to be poor. So his poor adherence is the problem for HIV monitoring. And as I said, like you have to go with the CD4 and viral load count. If the person who is not adherent, he will show his viral load detectable. So he is a likely candidate who can transmit to others, including his or her spouse. So likewise, you have to every particular visit you have to go for a counseling session. You have to go and emphasize for the adherence. However, there might be some issues for the compliance. So you can switch or change medicines depending upon the patient's acceptance. Say for example, as I said, Zudovudine might be having a gastritis. Efavirenz is a drug which can have a CNS side effect. Patient म्हणतो मला झोप जास्त लागते, मला चित्रविचित्र स्वप्न पडतायत, vivid dreams might be there. So if patient, even suicidal tendency is the side effect of that particular antiretroviral therapy also. Efavirenz is the drug. Nowadays, with the advent of dolutegravir is a wonderful drug, which which has a good penetration in CNS as well, and same for the plasma as well. So you will get an undetectable virus in both compartments, like plasma compartment and CNS or CSF compartment. So as you said rightly, like if someone is going for anti-TB treatment, if he is taking or not, you can see for the color of the urine, or you can ask the patient that whether he is getting a changed color of urine. Likewise, on a daily basis, it's little different. However, you can go for a adherence or counting of the number of tablets, pill counting, you can say number of pills, and you can every time you have to emphasize for the safer sex practices and adherence and compliance. नवीन सळसळत्या रक्ताला काही प्रश्न? So you guys might be chilling out mostly on Saturday, Sunday, if I'm not wrong. So you have to you can enjoy, but with a pinch of salt. As I said, like jawan ho but nadan nahi. Absolutely. कुठलाही HIV जर तुम्हाला म्हणजे डायग्नोज करायचा असेल तर मेन इम्पॉर्टंट थिंग इज यू हॅव टू गो फॉर अ ब्लड टेस्ट. हावेवर हिज रिस्क बिहेवियर हॅज टू बी डिस्कस विथ दॅट पर्टिक्युलर हेल्थ केअर प्रोफेशनल. लाईक से फॉर एक्झाम्पल माझ्याकडे कोणी आलं तर त्याला मनात इच्छा असेल की मला तपासायचं. आता आज दुपारच्या गोष्ट आहे की माझ्याकडे एक पेशंट आली, शी हॅड अ प्रिक 5 years बॅक. आपलं निडल तिला प्रिक झाली होती. she has a phobia that I have contracted HIV. That's what she was just complaining. You can say she has her some perception. पोटात गुडगुड होते, मला लूज मोशन्स होत आहेत, मला झोपच येत नाहीये, मला माझी तब्येतच वीक होतीये, माझं वजनच घटते. However, she has checked her for with the blood test 2 to 3 times. Every time she is negative. Today also she has given blood to my clinic. So you have to emphasize for the risky behavior, how she is behaving. You have to nullify their doubts. However, if someone is having a really risky behavior, especially ट्रक ड्रायव्हर्स, मायग्रंट पीपल, जी मुलं बाहेर गावावर शिकायला येतात त्यांना स्वच्छंदी वातावरण मिळतं, नो कंट्रोल इज देअर, सो दे मे गो लिटिल बिट हे वायर, त्यांचं पाऊल थोडं वाकडं पडतं. त्या पिरियड ऑफ टाइम इफ दे हॅव सच काइंड ऑफकोर्स तुम्हाला ते बोलतं करावं लागणार. अर्थात वन्स अ पॉझिटिव्ह पर्सन कम्स टू मी, I am not going to go into the details. My duty is, being a positive, I have to show him a way in a positive way for his further life. But if you are dealing with a person who is having some sort of a perception or who is having a risky behavior, you have to cut short there. You have to tell that particular person that no, this is not the way you have to live. Otherwise, you are at a risk. I mean, बऱ्याच वेळा पेशंट स्वतःच म्हणतात माझ्याकडे, I mean, I am going to utter that word as well. So 2 मिनिटाची मजा पण लाईफ टाइम सजा होऊ शकतो. So these things you have to, especially younger population has to keep in mind. And every time, whenever you want to go in a risky behavior, use safer sex practices. That means you have to go with the protected sexual life or maybe condom. I hope I have clarified everyone's doubt.
Anyone is having any question? Okay. सरांनी HIV एड्स दिनानिमित्त आज या विषयावर अतिशय महत्त्वाचं आणि मोलाचं मार्गदर्शन केलंय. त्याच्यामध्ये प्रेप आणि पेप अशा 2 प्रकारच्या वेगळ्या थेरपीज ज्या आम्हाला एवढ्या माहीत नव्हत्या डिटेल्स, अशा डिटेल्स गोष्टी पण आम्हाला आज कळल्या. आणि सगळ्या यूथला त्यांचा जो मेसेज होता किंवा स्पेसिफिक काही त्यातले रिस्क गोष्टी त्या आपण त्याला समजल्या आहेत. आणि दुसरं गोष्ट म्हणजे एम्पॅथी टुवर्ड्स द पेशंट, HIV पेशंट, तो पण एक मेसेज आपल्याला खूप महत्त्वाचा मिळाला आहे की कोणाला वाळीत टाकणं किंवा कोणाबद्दल एक हीन भावना निर्माण होणं ही चुकीची गोष्ट आहे. ऑल पेशंट शुड बी इक्वली ट्रीटेड, बी इट HIV, बी इट TB, बी इट एनी पेशंट, बी इट कोविड पेशंट. That is a very good takeaway message. I would like to मी चोरडिया मॅम आणि सिमी मॅमना इकडे मंच आणि सरांना इथे मंचावर बोलवेन. आणि चोरडिया मॅमना मी अशी विनंती करते की त्यांनी सरांचं फेलिसिटेशन करावं.
मुलांना तुम्हाला सेशन आवडलं का? पण कोणीच क्वेश्चन नाही केलेले. म्हणजे थोडस कसं वाटतंय, मला कळलं की नाही कळलं. स्टुडंट नाही, प्रश्न विचारलाच पाहिजे की आपल्या आपण तुम्ही डॉक्टर होणार आहात, त्याच्यामुळे हे प्रश्न
एक भीती असते प्रत्येकाच्याच मनात, इव्हन यंग पॉप्युलेशन, ओल्ड पॉप्युलेशन, एव्हरीवन, की मी 4 चौघात से फॉर एक्झाम्पल सिंपल आज डायस आहे, मी तर तुम्हाला सगळ्यांना विचारलं कोणाला डायबिटीस आहे का, मे बी 5-6 लोक एक वेळेस फॉर एक्झाम्पल कन्सिडर करूयात 5-6 जणांना डायबिटीस आहे. पण मी जर प्रश्न विचारला कोणाला HIV आहे का, नो वन विल, कोणी हात वरती करणार नाही, इव्हन इफ समवन इज पॉझिटिव्ह. So this is a kind of a society which we are living in. So बघण्याचा दृष्टिकोन वेगळा असतो की बाबा मॅडमनी पहिल्यांदाच सांगितलं की If someone gets contracted with HIV, not necessary that the person has got HIV due to his risky behavior only. No, not at all. Even if a doctor must have got a prick, or maybe in an emergency condition he might be helping to that particular HIV positive individual and maybe contracted with that particular HIV. We don't know. डॉक्टरकडे बघण्याचा पण मे बी दृष्टिकोन थोडासा वेगळा होईल समाजात. सो एव्हरीवन डझंट फिट्स टू, बट म्हणजे एकच माप सगळ्यांना आपण देऊ लावू शकत नाही. मापदंड प्रत्येकाला वेगळे वेगळे लावावं लागू शकतात. एक वन फॉर ऑल और ऑल फॉर वन असं करता येणार नाही आपल्याला या स्पेशली HIV फील्ड मध्ये.
थँक्यू.
प्लीज टाळ्या चालू राहू देत. Thank you so much, sir. Thank you, ma'am. Thank you, ma'am.